Now my other
you want to put a question.
learned friend from the Ace Radio.
West Side Radio.
Yeah, West Side Radio.
Rather than, I think, I put my
very learned, very learned.
Thank you very much for that opportunity, and I think taking notice of your importance at the time. This is the time for your constituency people, and this is the time for the people to focus who can make a change and stand for that. That is why yesterday I had received a text from Amanullah Saab and said, you are coming here, and then at 2 o'clock I went all around. But I believe that the media has got the responsibility to interface between the different departments, the public, and their people, representatives, in order to make the policies that can go along with the societies. So rather than I'm asking a question, there are 2 questions from the frontline people working in your constituency in an NHS trust, and I shall be very grateful to you if you listen to that so that you make the time useful, and please comment on that. These are the people who are working in the West Middlesex Hospital in the front line, doctor and nurses. Say what they want to ask you.
Hi, I'm a doctor at West Middlesex University Hospital. I work in A&E and I have been doing so for the last year. My question is, what is the current government and party being elected going to do with regards to budget spending with clinical and non-clinical staff? The ever-going managers, such as chief execs and logistical managers in West Mid, are increasing. However, I don't see the same increase with the clinical staff, such as doctors and nurses. What are you going to do with regards to increasing budget and securing jobs of the frontline workers, such as myself and my colleagues, the nurses? Thank you.
There's another question. So that knows.
Hi, I'm one of the doctors working in the frontline NHS trust, and my question is, how are we expected to achieve our 4-hour waiting targets in the accident and emergency if there are going to be possible cuts in the NHS budget?
Good questions.
Okay, these are the questions. Now, please, your answer. So that I have promised them that I'm going to convey to the Minister and make yourself being heard.
Could I thank you both for your questions, because as clinicians you are right to be concerned about investment in healthcare. What Gordon Brown and our government has said is that we will continue with the investment. This year an extra 5% and the following year. What we can do in relation to the unprecedented amount of money that's been put in the last 10 years, I suppose, and certainly since 2001, whether that will continue to be increased will depend on the economic circumstances at the time. But what we've asked the NHS to do, and what we've asked the Chief Executive at the Department of Health to do, is to look at, can we make savings that do not affect clinical care? The reason we're saying cannot affect clinical care is because quality and safety is paramount to us. Following your colleague in the medical field, Lord Aradazi's review. What we know is, apart from the fact that it is right to practice medicine at a high quality and safe level, it actually is more cost effective to practice it in that way. It costs more money to actually get it wrong. It's unsafe practice, of course, which could be much more difficult to manage for the patient and their family. But if you are looking at it from a cost basis, it actually costs more if you get it wrong. It costs more if you have complications. It costs more to bring people back for 1 or 2 times. It isn't the right way to manage healthcare, and it is not the right way that we will say that we will do that. In fact, if I can thank you for choosing medicine to start with, and in particular in A&E, the 4-hour wait in A&E is a safe target. Prior to this, we had people waiting on trolleys for hours, for 10, 12, 24 hours. It's unsafe not to be treated within a 4-hour regime. I know that because I've worked in A&E as a nurse, and I know how unsafe it can be to keep people waiting. You know, the Conservatives make a lot about targets. John Major's government in '92 actually had a target for 4 hours that they would also reduce to 2 hours. They totally failed on this, and people were left overnight. I don't think there are clinicians now that would say that to wait more than 4 hours is acceptable. What I will wholeheartedly agree with you is that to maintain that level of care and expertise, you have to have the right quality and numbers of staff to help you to achieve this. Managers in the NHS are very necessary, because actually to manage a system as complicated as the NHS, we require to have good managers and we require to have the right number. But I do believe again that we've had, I think it's 89,000 more nurses, 44,000 more doctors since Labour came to power, and we have no recruitment problem in either of those areas, and that is a good sign as well. Midwifery, we're still struggling to bring our midwives up to the number that we would like, and I know at the West Mid, because I work there, so I'm really pleased to have a question from the West Mid. I actually stood outside and marched through Hounslow. I got into a lot of difficulty and trouble. I was actually disciplined at the West Mid for saying that the hospital needed rebuilding. And it was a Labour government and it was a Labour MP, myself, that signed the documents in the same room I was disciplined in to say that we have our new hospital, we have the extra nurses, we have the extra doctors, and I will battle always to keep you there because you're doing a tremendous job. Our cancer target is correct. We will diagnose within a week, and we will, if you require treatment, within 2 weeks. We are proud of the work we do in the National Health Service, and I'm very grateful and very proud of the work you do in my constituency, and I thank you for that.
Thank you. Thank you.
There will be only 1 or 2 questions.
There's a
But
gentleman
before
who wanted to ask the question.
Yeah, I'm coming to you. Before that, I shouldn't forget to thank Arsalan Mirza, a gem of a gentleman and an intellectual, and our comrades in Islam, and he been in the humanitarian causes and democratic causes. The thing is this, our journalism doesn't believe in monopoly. We know a certain group, which is a global group, is trying to defeat Labour. We think that this is a sort of uncalled for kind of interference in politics of fairness. But before I pass on the mic to my friend, I just want to put you a question regarding a matter of concern to the constituents and to the nationals of this country. That is the bobbies on the beat. Police, more police. But at the same time, the root causes of crime. Because I think crime and health also go together, you know. If you could say a little bit on mental health also, that aspect. Just very briefly, and then you put the question.
I think mental health has improved, but not to the level that we want it to. So we're training 8,000 more therapists, clinical therapists, so that people can actually have the facilities without the weight that they require. Our lives today are very stressful. Our lives, I suppose, have always been stressful. Each generation creates its own. But the reality is that many of the addiction, in particular conditions that surround mental health problems, whether that be drug addiction or that be alcohol addiction, of course, also sometimes gets related to crime. And so we must find routes, we must find ways of rehabilitating our citizens so that they're not relying on a falsehood of what a chemical reaction can create in you, but that you actually have the opportunity to take the stigma away from mental health as well. That's very important. And to have those opportunities within our health service. If we didn't have our health service, where else are you going to have mental health catered for? Because there's no quick money in mental health. It isn't something that you can do like bringing people in for surgery quickly off a waiting list. It is ongoing. It is a community-based effort that usually requires the whole family to be supported as well. And so there is, without the National Health Service, we wouldn't have a mental health service, and we are intending to train more therapists.